Step 20, so medications. So in this step I will explain all about IVF drugs. I will explain what drugs you use in IVF and logistics of getting your drugs and the storage conditions. Essentially in IVF you get 4 different types of drugs. First is gonadotropins. These are drugs to stimulate your ovaries. These are the types of gonadotropins like Purigon, Follistim, Gonalef, Bimfola, Elonva, Ricavel, Menopur, Fostimon. These are all the drugs which are used for stimulation of your ovaries. Usually you will be on one of these drugs. So then you have antagonist drugs. Their role is not to stimulate your ovaries. Their role is to block your pituitary gland. So there are generally 2 different types of antagonist drugs, orgalutran or cetrotide. Second name for them, the ganirelix is orgalutran, cetrorelix is cetrotide. So then a third type of drugs are trigger drugs. The job of these drugs is to trigger the maturation. So once gonadotropin grows the follicles while antagonist is blocking your pituitary, so once follicles are large enough, they need a trigger drug for the maturation. So, and that's a drug which you normally use 36-37 hours before your egg collection. These are Ovidrel, Prignal, Decapeptyl. These are the trigger drugs. And the fourth type of drugs are progesterone. These are used for luteal phase support. These are used before your embryo transfer, and you continue until your pregnancy test, and if you're successful then you continue until 7 to 12 weeks of your pregnancy generally. So these are Crinon, Utrogestan, Endometrion, Oripro. These are all vaginal gels, vaginal tablets are progesterone drugs. Okay, so these are the types of the drugs you use. And now I will explain logistics in terms of how you will get your drugs. So essentially you need to find out about the prescription and collection of the drugs. In terms of prescription, you need to find out how you're going to receive the prescription. Is it going to be paper prescription, or sent by email, sent by text? Is it going to, are you going to, whether you're going to receive the prescriptions yourself or it will be sent to your pharmacy. Understanding of all this will help you to reduce your stress level. It creates certainty, so you won't be uncertain and unclear about your drugs. So when you're speaking to the nurses or your specialists, you really need to clarify the logistics of obtaining prescription and obtaining of the drugs. In terms of collection of the drugs, you need to clarify whether you will be collecting the drugs from your IVF clinic or from pharmacy, or whether it will be delivered to you by your IVF clinic or pharmacy. So elimination of all these little stressful questions is very important in IVF, so that when you start your IVF you can just focus on your medical treatment. Okay, then storage conditions. Of course you need to check the storage conditions, reading the instructions, and also talking to pharmacy, talking to your own clinic, but I will give you general guidance on how to store your IVF drugs. Okay, so there are 2 different types of drugs, injections and progesterone pessaries or pills. So injections, pretty much all IVF injections like antagonists, gonadotropin, agonists and triggers. So essentially there's 3 different type of storage conditions. One is long-term storage. Let's say if once you bought the drug, if you're storing the drug in the fridge 2 to 8 degrees of Celsius, then you can store these drugs long term until they expire. So, and if you are storing the drug between 2 to 25 degrees, which is in room temperature, then you can store those drugs for up to 3 months. Then if you prepared the drug, let us say you started using let us say Gonalef, for example. Then once you started, you pierce that ampule, started using, and you may have some left, so which you can use in the future cycles. Once you pierce the ampule, then you can store that drug in a room temperature and use up to 28 days. Of course, you need to check this with the manufacturer's instructions. So this is just general guidance. So all the progesterone drugs you can store long term in a room temperature from 2 to 25 degrees of Celsius for long term until they expire. So this is about the storage conditions. So understanding of what drugs you use in IVF, how these drugs get delivered and how you store is very important step in terms of minimization of logistical stress involved in IVF.